Hello, my name is Dr. Lars Eric Larson, and I'm a chiropractor. In the next 30 minutes, I will review some fundamental health information that's applicable to everyone. Some of my talks are very specific, but they all involve basic health tenets. Now, my mission is to both educate and check as many individuals and families as possible in my community in regards to their spinal health and those conditions associated with spinal health. Now, today's topic will be headaches, an epidemic. And what we're going to talk about is all the different types of headaches and what you can do to get rid of them. Now, I prepared a slideshow, so let's start by taking a look at our very first slide. And it says, the most common ailment, learn the facts. Now, please realize that it's never okay. It's never normal to have a headache. It's a sign that something's seriously wrong inside your body, and usually involves some type of stress. And we'll talk about all these in just a minute. So let's go and take a look at our very next slide. Here we have a pyramid of vital needs, and we're going to categorize them. The first is nutrients, then you'll see water balance, oxygen, and nerve flow. Now, the reason it's set up like this as a pyramid is that nutrients form the base of your body's vital needs. The second most important topic would be your water balance inside your body, and then we'll move up to oxygen, and then at the very top you'll see nerve flow. And we're going to discuss why that's so important, because if you don't have proper nerve flow in your body, you actually can't survive for very long at all. Now let's take a look at our next slide. Headaches, an epidemic. More than 45 million sufferers estimated in the United States. The most common reason to seek medical help. And we break them down, primary headaches and secondary headaches. Now let me discuss the difference between primary and secondary. Primary headache would be something such as a migraine, or a cluster headache, or a tension headache, or something called servogenic, and we'll discuss that in detail in a few minutes. A secondary headache would be something due to what we call in the medical field a space-occupying lesion. This may be something like a tumor, so the actual headache is being caused by the tumor, or it could be some other illness such as, say, high blood pressure. So the high blood pressure in and of itself is the cause, and then the headache would be secondary. So let's take a look at our next slide. Now, which type do you have? There's a couple different features for each kind. Brief, painful bunches, 15 headaches per month, tightening of neck muscles. It could be centered around one eye. It could be dull and steady over the entire head. It can involve the range of motion, so your neck could be very tight and sore. And you could have paralyzing pain that puts your life on hold completely. Let's look at our next slide. We'll start by first discussing chronic tension headaches. It's the most common variety and usually affects women more than men. It involves a tightening of the muscles in the face and the neck and the head, and is usually described as a dull, steady pain over the whole head. And it's estimated that 43.6% of these patients report reduced job effectiveness. So let's talk about the chronic tension headache. Typically, it's going to involve women. Now, we're not entirely sure why women get this type of headache more often, but it may involve the hormone estrogen. So some women, it might be a chemical component in there that exacerbate or could even, in fact, cause the headache. And so it may affect women more than men. So we're going to look at a couple different categories as we go on. We're going to look at physical stress, chemical stress, and emotional stress as the causes to headaches. Let's look at our very next slide. Now, here is the cluster headache. Typically less common than the tension headache, but affects men more than women. They're described as brief but painful bunches of headaches, and they strike over a period of weeks, usually centered around one eye and accompanied many times with nasal congestion. Now, once again, it's possible that cluster headaches have some type of chemical hormone component. In males, we produce testosterone, that's our main hormone, and that may be a link to why men get the cluster headache more often, and with women you get the more of the chronic one. So in both cases, there's usually other components, and we're going to talk about some of the different things that underlie these various headaches. Let's look at our next slide. The chronic daily headache. 35 to 40% of patients who seek treatment for their headaches suffer from daily headaches. And the criteria is a minimum of 15 headaches days per month or 180 headache days per year. Now, typically when you have a chronic daily headache, it involves usually one of these other categories. So what you have is you start with the tension headache, or the migraine, or what we're going to call the servogenic headache, and then over time it just becomes a pattern, so you have this daily repetition of headache. But usually there's something underlying this headache, and that's what we're going to discuss next. Let's look at our next slide. And this one says the missing link, the neck. Joint dysfunction, movement in ligaments, muscles, or vertebra can trigger headache pain. This is the servogenic headache, which overlies many different headache types. Now, I'm a chiropractor, and one of the most common things that we deal with is a condition in the neck or the rest of the spine called a subluxation. Now, that's when the vertebra, the bones of the spine, misalign and create some type of nerve problem, nerve interference. And it's usually a twisting, a pulling, a stretching of the nerve tissue after the bone comes out of alignment. Now, there's another cause, okay? So that's the subluxation is one portion of a servogenic headache. Another might be where the primary concern is actually the muscle. The muscle's starting this whole process, and that would be related to trigger points. Those are little areas in the muscle that form a really tight bunch in the muscle bundle, okay? And it blocks out blood flow from coming through that muscle and starts to store toxins inside the muscle. So that can be also the cause of the servogenic headache. So, and now there's one more type. That's where maybe the bones and the muscles gang up on the nervous system itself, what we call the autonomic nervous system. And that's what your body uses to control a lot of the things that you do without your conscious control. It just happens automatically. And one of those things is the blood flow in your arteries as they open and close. So if you have subluxation or if you have trigger points, that may affect the autonomic nervous system and then eventually your vascular supply. So many headaches of the servogenic variety are not only affecting the nerve, but also the way that your body is dealing with its blood supply by opening and closing. So that's the basic underlying tenets of a servogenic, meaning produced in the neck. Let's take a look at one, not a slide this time, but how does the neck get out of alignment? And one way would be through accidents. You could probably think of that, whiplash or sports injury where the neck gets out of alignment. Another one is, let me show you, turn this way, is poor posture. So if we're hunched over and we're at our job, we're driving cars, posture can be a cause over time to headaches getting started. So let's pan and go to our posture chart. And you'll see on this chart, all the way to the left of your screen, you'll see normal alignment, the head positioned over the shoulders. And as time goes on, you'll see the head start to move forward. This does a couple of things. it changes the muscle tone in the neck, and it also changes the alignment of the vertebra, straightening out the curve in the neck. If left unchecked, this is a progressive condition and may lead to chronic bad posture and then to things like arthritis, which can best be described as a cavity in your spine. As the bones stop moving properly, they'll get things like calcium builds up and loss of range of motion and also loss of space between the discs and the joints. So posture can be a definite cause of servogenic headaches. Let's go to our next slide. And this says headaches in your neck. University of Maryland research proved that there is a direct attachment or bridge between neck muscles and the dura mater. And I'll describe the dura mater in 1 second. Lack of joint movement and increased muscle tension can cause headaches. Now, what do they mean by the dura mater? Well, the spinal cord and even your brain is surrounded by a sleeve, just like my arm is right here. And what can happen is, we've found, is that the muscles are attaching directly. There's a little bridge attaching directly to this sleeve around your central nervous system. And what can happen is that dura mater can actually start to twist and turn and stretch and pull, and that would also contribute to the headache. And it's a main starting point for even subluxation. So as the bone moves out of alignment, as the nerve that's going out to all your cells gets stretched, also the spinal cord itself and its sleeve gets stretched and twisted mechanically. Traction and twisting of that whole system. And we think, as a chiropractor, is one of the main causes of headaches. Let's take a look at our next slide. Now we're going to discuss migraines. Over 30 million Americans suffer with migraines, 3 times more common in women, and also a family relationship. 50 to 75% have relatives with migraines, and they're closely related to servogenic headaches. Now, once again, many migraines may have that component of the hormones because they're affecting women more often. In my clinic, I adjust many people with headaches, and chiropractic adjustments can have great effect helping the alignment and thus changing the way your bones and your nerves are interacting. Now, with migraines, there's several different theories. There may be food triggers. There may be emotional triggers that cause the body to just start producing headaches. Light sensitivity of that nature. So while we're not 100% sure as a group of doctors in the United States as to what causes migraines, there seems to be several different causes. And as a chiropractor, we relate a lot of the migraines back to the servogenic headache. So we link the two and think there may be very close relationship. So once again, the subluxation, bone affecting nerve, muscle trigger points, muscle affecting bone and nerve, and then both of them ganging up on the central nervous system and changing the way that the blood supply is working in your body, and specifically up in your upper region, your upper body, your head and neck. Let's take a look at our next slide. Migraines are on the rise, 60% increase over the past 10 years. These can be described as excruciating and many times involve visual disturbances or, as I mentioned, sensitivity to light or noise. Many times associated with nausea and vomiting. Many times patients come in and tell me they've been vomiting all night due to their migraine headaches. And they may be triggered by the menstrual cycle, weather changes, or even foods. So once again, migraines are very devastating, and I deal with migraines almost on a daily basis. Many of the people that come to chiropractors, it's their #1 chief complaint is that they're there because they have headaches. Many having not realized for years that chiropractic can be very beneficial. And I have quite a few patients that started with lifelong headaches and that now come in and see me as a chiropractor for wellness care and no longer have their headaches. Now, why would they be on the rise? Possibly due to increased stress levels. As you know, all of us are under increasing amounts of physical stress. That would be accidents, injuries, and our posture, okay? And also emotional stress, everything that we're due with our life. And also chemical stress. So as our diet degenerates, I don't think Americans' diet is as good as we might like to think it is, okay? You hear a lot in the news with people having trouble with their diet. This may be a true factor in the migraines. Let's take a look at our next slide. Lost work days. Migraines specifically, but many headaches are affecting our workforce. Fact, migraine sufferers lose 8.1 work days annually and have another 4.9 days of reduced effectiveness. And I think it may be higher than that. Fact, other headache types total another 8 lost work days annually and another 6 lost days due to reduced effectiveness. So it's definitely affecting our whole workforce. Let's take a look at our next slide. The treatment can trigger the headache. Now this is an important point. Taking more than 3 aspirin or other medications 2 to 3 times per week can turn intermittent headaches into chronic and daily headaches. Now, we are going to talk about the rebound effect, because many people, as you know, you'll see commercials and such on the television, are taking medications in order to deal with the headache. Well, that's like, I'll give you a good analogy, driving in your car and the oil light comes on and we're just going to reach down and clip the wire and get rid of the oil problem in the car. Same thing. When you're taking medications, you're cutting off the message from your brain to the rest of your tissue cells. And that is not the right thing to do. And as we take more and more medications, there are many people out there dealing with the rebound effect, meaning that now the original problem for the headache is gone. And now it's the medications, the cycle, the chemical stress that's actually causing the headache. We know this to be true. And many people, by reducing their medication, in conjunction with their medical doctor, getting off of these drugs and trying some different approaches, can actually reduce the headaches overall. Let's look at our next slide. Aggravating factors. We talked about the neck curve, degeneration or arthritis, traumas to the neck, that's physical stress. But there's a whole list here of chemical stress. Fruit drinks, tea, breath mints, some frozen ice creams, yogurt, pudding, gelatin, chewing gum, laxatives, a whole list of stuff, even some vitamins. And one of the biggest triggers, believe it or not, is a substance called aspartame. Now, many Americans now are using diet sodas as their primary drink, or they're eating a lot of products with aspartame in it. Now, this is a neurotoxin, and it's not a very good product for the human body. In fact, it has methanol as one of its components. And we know that methanol is basically wood alcohol and is toxic to the human body. So as your body consumes aspartame, your body has to go through a detoxification process every time you have that product. And it's very stressful on your tissues. And in my opinion, aspartame should not be drank by anybody with headaches specifically, but even people without headaches, because it could end up being the cause of headaches, in my opinion. Well, let's take a look at our next slide. The true agenda for relief. As a chiropractor, I think the most important thing is to have your spinal alignment checked. Chiropractic adjustments. That restores nerve flow. We improve posture and reduce muscle tension. And we improve that range of motion globally throughout the whole body, but individually in the various joints of the spine. Then obviously your diet can be upgraded. You can remove food triggers and reduce our stress, increase our exercise, increase our sleep, and reduce the use of medications. So as we'll see, or as we have seen, the cause of headaches is many times multifactorial. But if we look back at it, physical stress, chemical stress, and emotional stress is the true cause of headaches. And if you've gotten in an accident, if you've lost your natural alignment in your neck, If you're at work and you've lost your posture, well, then I would say that may be the primary cause of your headache, and it's back to that servogenic model that we talked about. The bones, the trigger points in the muscles, and the altered blood flow in your body. Now, emotional stress is overwhelming in our society, causes a lot of the same things. Increases tension within our body, and that may be, in many people, the underlying cause. If we reduce the stress, the emotional stress, then the headaches start to dissipate. And with diet, I'm sure you're all aware, we must drink lots of water. Water is extremely important, and we should eliminate things like diet soda. Even alcohol and coffee for some people are the actual triggers for headaches overall. Let's take a look at our next slide. Proven to be effective. Fact, 98% success rate in immediately terminating migraines with chiropractic adjustments and traction. Another fact, adjustments provided to servogenic headache sufferers resulted in decreased analgesic use, headache hours, and headache intensity. Chiropractic, in my opinion, is the most effective way, is a starting block for where you can get relief from your headaches. I also look at everybody's history. We try to tune up your diet, look at some of the areas of emotional stress, but that underlying spinal curvature, that motion of the spine, and reducing muscle tension and bony subluxations is where I start with most or all of my patients. Let's look at our next slide. And we're going to recap by going over the vital needs: nutrients, water balance, oxygen, and nerve flow. And I keep going over this point, but your food is important, okay? We've got to get toxins out of the body. Water, fresh water is your best bet, and lots of it. Reduce your need for other liquids. Oxygen, that's your exercise. You got to get moving, okay? And many times that can be why your body is starting to tighten up. And then nerve flow. We've mentioned posture, we've mentioned the subluxation, and we've mentioned trigger points affecting the proper alignment, the nerve flow, and even the vascular supply in your body. So if any of you would like to have more information on headaches, any of the various types that we've discussed, or if you'd like information about your overall health, please don't hesitate to call me. I am on Pine Street in Burlington, and my phone number is 951-5700. I hope you've learned something here today, and I wish you a great day, and we'll see you soon.